All right, thanks to all of our gold sponsors today. Our next presenter is Sue Shegley. She comes to us from United Health One through the National Key Accounts. We got started with United Health One last year. As you know, we've been with United Healthcare Medicare Solutions for a long time. I just want to clarify something. There are 3 different ways that you can get contracted with United Healthcare. So if you think, oh, I'm already with somebody else, you may or may not be. You've got a group contract, you've got a Medicare contract, and you've got a United Health One contract. In Texas, it's All Savers Insurance Company, formerly Golden Rule. So there's a mouthful of a lot of conglomeration. But I'm excited about them this year. I think we're going to be able to really put some numbers up on the books, and Sue's going to give you a couple of reasons why. Sue, come on up.
Thank you very much. What I'm going to talk to you guys about today is I come from Indiana, so I'm not from Texas, and you probably can tell by my accent already, right? But I'm going to show you kind of the big picture of what United Healthcare, United Health One, we're doing when it comes to expanding in the, we'll call it the state presence for on and off exchange. So what I'm going to take you through today here is, I'm not going to dive into Texas too deep, and the reason is, as our previous speaker talked about, we're still waiting for Department of Insurances to approve the plans. So this is all intended and applied. So I'm not going to, and filed. I won't say we're 100% until we get the piece of paper from the DOI. Okay? So let me check my little thing here. Make sure this works. Okay, here we go. All right, the national footprint that we're talking about. You cannot sell anything till November 1st, as most of you know. So this is the under 65 market that we're talking about. How many of you sell under 65 now? Good, good. One of the things after I go through the ACA platform, I'm going to give you some options that we have also, how to bridge to open enrollment and bridge to your Medicare clients. So we've got products and tools that we will keep trying to expand for your use and obviously to capture clients now and not wait, okay? So as you know, November 1st through January 31st. And keep in mind, like last year, the government could extend it beyond. We don't know. We'll wait and see what they decide to do. But as of right now, this is the time parameters that you're allowed to sell for January 1 effective. Okay, so basically looking November 1st through December 15th for 1/1 effective. No, I'm going the wrong direction. Hold on. Okay, here's what we've got. On exchange and off exchange products, this is our 2016 plan form and what's going to be available, okay? One state in Utah is where we're going to only be off exchange. We will not have an on exchange product. And then no United Health, and just so you know, when we get into names of companies, anything that's written off exchange, meaning non-subsidized, is under the name of United Healthcare Life Insurance Company. Okay, so when you start to see some of these names, and I'm going to show you at the end all of the licenses that we have across the country, because it kind of gets a little confusing over time. I keep pushing the wrong button here. Okay, off-exchange expansions, we're going into 2 new states. We're going into Iowa and Kentucky, which is a step out for us. So in other words, we were in 26, now we're going to be in 28 states. We'll have full-blown platform, co-pays, HSA 100s, and select savers in those states, and it'll be consistent nationally. Now that's where this gets a little challenging, and I don't know about the other carriers, but for us, when it comes to on-exchange versus off-exchange, every state seems to have a different platform for on-exchange when it comes to product selectivity. So, but when it comes to off-exchange, we're national. So what we offer off-exchange is across the entire country. There is no variation. So once we roll this all out, you'll be able to see what I'm talking about. General portfolio, we're going to have a full gamut of the plans, as you can see. We will be cutting back on platinum. I'll be real honest with you. What we found was, and I don't know about the other carriers, but we found that there were people that bought a platinum plan, paid a couple payments. Granted, it was very, expensive, but they made a couple payments. They had their $500,000 heart surgery, and they stopped paying. Guess who gets holding the bag? The insurance company. So it's starting to put companies out of business. It's starting to change the environment. So we're cutting back a little bit on platinum plans, just so you know. So we're going to see a lot better positioning in the gold market and the silver market. Here's our on-exchange, subsidized platform where we're expanding. So we're going into 11 additional states, including, oops, I'm going the wrong direction again here. This thing is, hold on, going the right. This is backwards for me, sorry. What am I doing here? Up seems to be go up, but down is down, so I'm messing this whole thing up. I apologize. All right, here we go, sorry. We're going to 11 new states, so we'll be up to 34 states. We're going into California, Washington. They're big steps for us. Texas, obviously we were here last year. We'll be here again. To give you a perspective of, we're even expanding into counties. And as you can see, in many of the states, we've got county expansion. We plan to do that in Texas, but we're going to hold back at this point in time. I think in 2017, we may go into the entire state. But as of right now, we're going to stay where we were last year primarily. But as you can see, our footprint is dramatically improving, just exploding. So for those of you that, how many of you have non-resident licenses? Anybody? Okay, good. This is where you may want to consider expanding into some of the states that maybe doesn't have a presence currently with us. So it's basically just getting your non-resident license approved and submitted to us through the brokerage so that we're set up to go when it comes open enrollment time. General information on poverty limits. It's another, with a 400% of federal poverty, you can see who qualifies for a subsidy and who does not. So obviously, we usually target about 75% of that, to tell you the truth, because as soon as you get into the, a couple bucks here, a couple bucks there, they get a better choice of network when it comes to off exchange, so it may not be worth them going through the exercise. So just kind of think through that with your client a little bit. General portfolio, the traditional, the copays, HSAs, catastrophic, we'll have them all. Just a snapshot again of what the metallic plans look like. Most of you probably are familiar with this. For folks that haven't gone into this market, obviously this is how it all lays out, just to show you in general. Now, one thing I will say that United Healthcare is, the client will need a PCP. They will need a primary care physician. We're going to be doing something this year that we did not do last year, and I will first and foremost apologize for all the challenges we had last year. We know we had issues. We know certain things didn't get sent out on time. We realized there were all kinds of hiccups on our side. This year, when a client enrolls in a plan, what we're going to be doing different is within 5 to 7 days of receiving either that from the government, because they did it through the healthcare.gov site, or through our site, they will receive a card in the mail immediately. That card will show up just like a credit card does, with a sticker on it. And that sticker says, please call this number to activate your policy. Pick your primary care physician and make your payment. So if they haven't done all that, that's going to activate and show that that's indeed, they want the policy. Because we had many situations where we'd get the 834, and you probably heard this before, but the 834 report from the government with an agent affiliated with that policy, 1 month. Next month, we get the same client applying for another policy with another agent. Third month, we got another of the same client. They bounce around thinking, oh, I can get it from over here, maybe I get it cheaper over there, I'll go to healthcare.gov and get it over there. See, we had no idea which one, obviously, was the one that client wanted. So that's going to try and mitigate some of this, and it's going to tie your NPN number to that policy, which I think is extremely critical. There were many cases where the NPN number didn't get connected to the policy, therefore you didn't get credit. So if you're not currently appointed with United Health One, talk to the folks up front from the brokerage to get appointed, because we were so inundated last year with appointments that we had to shut it down. So do it now if you haven't done it already, or if you're not sure if you're appointed with us, check with these guys and make sure that you are, okay? But get it done sooner than later. Here's an overview of how many plans we're going to offer by state. This is on exchange, so as you can see, in Texas, let me find my little thing here. We're going to have some substantial plans. This didn't lay out very well, did it? Yeah, the slide doesn't look too good. I believe it's a total of, it should be 12. I don't know why that's not laying out right. Certification, they just opened it up a couple days ago. So go online to the CMS, get your FFM certifications complete. One thing we do not need is we do not need your actual certificate anymore. I highly suggest you print it though, and keep it on file somewhere, or give it to the brokerage to file it, however you guys agree to do it, but we don't need it. We're gonna be getting data feeds from the government every 2 weeks now. And I'm assuming all carriers in the same situation. But from our perspective, we will not need that certificate. But one thing you will need to do is you're gonna need to go into the back office of our eStore, our broker portal, which I'm gonna show you here in a second when we get to it. But you'll need to enter whatever username you used to create your CMS account, or the one you currently have. Make sure it's in our system. We're gonna be a one-stop shop now. We don't have to bounce to healthcare.gov like we did last year, so that should save a lot of time and trouble. But overall, you can kind of see, we're looking at which states fall into the FFM bucket. But I'd like to show this because I travel, I have to go do this all over the country. So, and I deal with many states and many agencies that have brokers in multiple states. So that's why I like to show this, because if you are getting licensed in a state-based exchange state, you need to go through their certification process. What I'm talking about here primarily is the federal, since most of you guys are approved in, or living in Texas. Or I should say that's your primary resident state. Here's what you'll have to do when you go online to take the certification. Part 1, and for those of you that did not do it last year, need to do Part 2. If you did last year, you only need to do Part 1. Okay, so just be aware of that. There was a lot of hiccups last year where agents didn't realize they had that second verification process to go through. And like I said, we don't need to obviously receive the actual registration anymore that you did it, but you need to do it before you can sell, okay? And again, like I said, we don't need the certificate. Here's eStore. This is our broker portal that we use, and this will be a one-stop shop, so I'm gonna show you some snapshots of what we've changed. We're trying to make this even better and user-friendly, but write this website down, and if you've never gone on there, go in and create a new registration account. It's very simple. Know your NPN number, create a password, and you're in. It's almost that simple. Single enrollment site, start to finish. We're going to add on the cost sharing plans, which we did not do last year in many of the states. And we're going to have a health form resource page as well. So this should help keep you informed of what's going on, resources to connect to, etc. We will preview the product. You can actually go online October 2nd and see rates. So we're going to show you guys the plans. You can't write them because obviously November 1st is open enrollment, but you will be able to see all the rates. You can start planning, kind of planning out who and what you're planning, who you're going to talk to. Keep this number. This is our broker service number. We're adding 200 bodies to that number just to keep up with what we anticipate to be the volume. Our client services, we're adding 2,000 people. So this is getting to be quite a substantial undertaking when it comes to expanding on and off exchange. Now, here's, I just mentioned earlier, the licenses. As you can see in many of the states, they mentioned All Savers. That's what it is in Texas, okay? Some of the other states you can see, obviously, for this is on exchange, where we have to house the products. Now, what do you do between now and open enrollment? Or what do you do for the folks that are not quite 65 yet? Short term. It's almost a logical answer. I was at the AARP convention this past, in Miami this past March. I could not tell you how many people I talked to. I'm 62, I'm retiring, I don't want to buy Obamacare, what do I do? Short term. I said, well, we can write up to 360 days now. We can do consecutive terms. Granted, you are subject to penalty. It is not an approved plan, or I should say, it's not a qualified essential benefit plan, but it solves people's problem. And you can't capture your client now. You don't wait till they turn 65. So you've got some options with United Health One. We've got new state expansions, and obviously you can see Texas as part of that. Simplified, it is underwritten. So if somebody's diabetic or they got some problems, this is not a product for them. There are basically 6 questions, and we have removed the blood pressure question. That is no longer a question. We can write anywhere from 30 to 360 days, and we can offer a per cause or per term deductible now. This is the plans, just to give you a snapshot. I'm not going to go into a lot of detail, but go online. You can get a feel for it on your own. Probably the biggest seller we have right here is the Medical Plus Elite. We've expanded the drug coverage in a lot of these plans. I'm not going to go into the detail on those, but you can see those and you can do side-by-side comparisons on the plans. Eligibility, 19 through 64 in 11 months, up to the age of 26. We do not require citizenship, but we require 12 months of residency, okay? They can pay in multiple ways, EFT and or lump sum, and we obviously will do paper if they want it, but we do charge for that. They will save up to 30% if they pay lump sum. So as you can see here, real quick, this is a monthly payment for a 2-month term. Obviously, 59 times 2 is not 92, but if they pay one single payment one time, it's a lot cheaper. So of course the logical question is, well, what if I don't use it all and I've paid for all of this? Well, we will return unused premium to the day that the client cancels. We have no reason to keep it. And if for whatever reason you have clients that have no technology background, or have no access to email, call in to our broker service number, the one I showed you. They can do that's the number right here. You can do a tele-app. We'll take the application over the phone, we'll take a verbal signature, take the payment, and we're done. And that's it. If you have any questions, I'll be over at the table. I know this is a lot and fast, and normally I probably will go an hour because there's so much detail in this, but I appreciate your time. Thank you very much. Let's sell ACA plans.